I am Mahima Gulati. I'm an associate professor of endocrinology, diabetes, and metabolism at University of Connecticut in Farmington. So we confirm type 2 diabetes remission by measuring their hemoglobin A1C, also called their glycated hemoglobin. And that number needs to be below 6.5% to be called in remission off of any medications being taken for lowering their glucose. The way that type 2 diabetes occurs is that they have these excessive lipid droplets in places that they should not be in, whether that's the pancreatic beta cell or whether that's the liver. And when somebody embarks on a therapeutic lifestyle journey, they can make that excessive lipid deposition reverse. And that would lead to decrease in the stress on that organ, whether that's the liver or the pancreatic beta cell. And we've seen from studies that the pancreas can literally regrow in size and become, like a smooth margin again instead of an irregular margin. So we've actually seen anatomically a detailed reversal of the disease in MRIs. And so people can reverse their type 2 diabetes. The key trial is the DIRECT study. It was actually done in multiple centers in the UK. It was a cluster randomized study. And then the same study was replicated in Australia, but without controls. And we do know from data that if people lose a certain percentage of body weight, it can be as little as 10 kilograms or 22 pounds. Some authors say 10%. The chances of their being able to reverse type 2 diabetes is as high as 67 to 70%. But if they do it earlier in their type 2 diabetes journey, it may be more successful. If they've had type 2 diabetes for over 8 to 10 years, it becomes harder to remit the diabetes. So I think our community, our country, our culture is ready for this conversation. I think first and foremost, come read the literature, get educated about lifestyle medicine, get educated about all the 6 pillars, know what resources you have. And then once you are aware, once you really have informed yourself and equipped yourself with the huge body of evidence that already exists, you will be a force in your health system, in your community, to your patients, to your own personal families and friends, and to your own self. I think it is an optimal solution to so many things that affect today's providers, whether that is burnout, other forms of insecurity around us. This really can become that catalyst of conversion. So definitely that's, something worth embarking on.